Breast implant illness is a very controversial and a very hot topic. There are a lot of women out there who feel that their breast implants are making them sick. The hard part for plastic surgeons is that while we agree that more studies need to be done, a lot of these patients present with sort of vague symptoms. Things like fatigue, muscle weakness, brain fog, hair loss, and those are general symptoms that could be attributed to many disease processes. And I think breast implants are being blamed for a lot of things that they're not really the cause. Now, that's not to say that we shouldn't be taking these symptoms of these patients seriously. Obviously, I think that we should. We need to take care of our patients. We need to send them to the appropriate doctors for appropriate workups. As a society, the American Society of Plastic Surgery, we're very committed to trying to think of ways that we can accurately study the devices that we're currently placing in women. I think it also gets confusing because a lot of the patients around the world that are having these symptoms have a wide variety of implants. So in other countries, there's lots of different devices that they use that we don't use here. And even in this country, we have smooth devices, we have textured devices, we have anatomical implants, we have third, fourth, fifth generation gels. And all of those implants, while they're all breast implants, they're all very, very different. And the implants that were used in the 80s and the early 90s, we know that those implants were problematic. The gel would bleed, they had a high chance of rupture, and that silicone could leak out into surrounding tissues and potentially cause problems. We feel confident in the studies that were done that show that those patients didn't have systemic disease and that breast implants don't cause cancer. But medicine is constantly evolving, and I think it would be really arrogant for surgeons to think that we know it all and that there's nothing to learn about this. While I do have empathy and feel sad that so many women have had to get their implants out because they feel like they were making them sick, and I'm so happy for those that have, that they feel better. As a scientist, I feel like it's our job to really get to the bottom of this, to really understand. Because again, some people might be sensitive to it, and we need to kind of figure out why. Is that a genetic thing? What is it that makes them more predisposed to have an issue with these implants? But I think to just say that breast implants are horrible and they need to go is really a disservice, not just for the aesthetic patient, but for the patient that has breast cancer, that loses their breast, and it really is like losing a piece of your identity and who you are. And I think that we need to be responsible in how we approach this.